Has your hand ever started shaking when it was time to cannulate a dialysis graft? Maybe you were afraid of hurting the patient or missing the access. If that's happened to you, you are not alone. Today, I am going to show you exactly how I cannulate an AV loop graft using the rope ladder technique so the next time you're at the chair, you feel much more confident.
In our prior video, we already identified which side was the arterial and which side is the venous, so we'll start there. Before I insert a needle, I first choose my arterial and my venous sites using the rope ladder technique. Once I've selected my sites, I prep the skin and allow the antiseptic to dry completely. I stabilize the graft with a non-dominant hand. Then, with the bevel up, I insert the needle at approximately a 45-degree angle. I wait for the flashback, I lower the angle, and advance. Once my needle is in, I secure the needle using the butterfly technique for the tape. I prime the needle line, removing all air, and I flush with 10 cc's of normal saline solution. I close the clamp and I leave the syringe on. I repeat the process with the venous needle. I always place one needle at a time. I secure it, I prime it, and then I flush it. Okay, now that you've seen the entire procedure, let's slow it down and review a few important things.
By the way, if you're studying for your dialysis certification exam, I put together a free quick start guide that shows you what topics deserve the most attention. You can grab it through the link below.
I always start with my access assessment, the look, listen, and feel, and identifying which side is arterial and which side is venous. I've already made a video covering those topics and I'll link it below. Then I make sure I choose a needle insertion site using the rope ladder technique. More on that technique in another video. I make sure that I'm holding the needle with the bevel up. My cannulation angle is at about 45 degrees. This prevents scraping, which can tear the graft material, and it allows me to cleanly pierce the wall of the graft without causing structural damage. I make sure that the tip is in and I wait for my flashback. Once I see my flashback, I lower my angle and advance. To prevent recirculation of the same blood, we want to make sure that our needles are about 2 inches away from each other. In a loop graft, this is much easier because we can place one needle on each side of the loop. The venous needle always goes with the direction of the flow, antegrade, and the arterial needle can go either way, antegrade or retrograde. With a graft, we never use a tourniquet. Let's watch the whole process one more time. Now, let's talk about some common mistakes. Mistake number 1, not stabilizing the graft. I like to use the C technique to do this. It really helps to achieve a clean entry. Mistake number 2, advancing before lowering the angle. If you advance without lowering your angle, you risk piercing the back wall of the graft, causing an infiltration. Make sure you see the flashback, lower your angle, and then advance. Mistake number 3, wrong direction of blood flow. Make sure that your venous needle goes with the direction of the flow. This will help avoid recirculation. The arterial needle can go either way. Mistake number 4, needles too close together. If your needles are too close, you also risk recirculation of the same blood. The patient receives the entire treatment, needle pressures are stable, but when tested, we realize that dialysis adequacy has not been met.
Before you cannulate any access like this type, you need to know which side is arterial and which side is venous. If you haven't watched that video yet, click here because it really is the foundation for everything we covered today. Don't forget to subscribe and like this video because it'll tell me that this information is helpful. And if you have any requests for a topic, just comment below. I'll see you in the next video.